So thanks to the organizers for having me invited to this workshop. And so this kind of things can happen when lawyers take the floor. And so to change the things, to remain the same. Well, first of all, I would like that you forgive me for my voice, because I got a call during the flight, but I have nothing to report at the moment because I didn't take no medicament. And so after these excellent presentations, I feel myself much better. I think that this is the placebo effect after having here these excellent presentations. Well, I would like to say also that my presentation is a part of a report that I made by request of the Quality Agency of the Spanish Ministry of Health. What are the legal consequences of reporting for healthcare professionals? So I could summarize into main ideas that I will implement later. First the first one should be that the identified problem should be resolved as soon as possible, because otherwise, when repeating the same adverse event or medical error, could be a clear source for legal responsibility, both for professionals or for the centers as such, because it means that the problem has not been resolved, and so the source for the risk is kept there. And secondly, that is also very important, but only for some member states, that of the European Union, of course, that some legal duties in several legal systems of some member states, as I said, they are reporting to judicial authorities is a legal duty. If the event, especially if the event could have a criminal relevance, for instance, criminal negligence, or also when they could be have a duty to declare as a witness in a judicial process. Well, you have there in the slide some concepts and that the elements that are together. So to reach the high level of quality at the end is to prevent or to reduce harm to patients and also to professionals, to healthcare staff. Well, changing views on reporting by healthcare staff or healthcare professionals. In some cultures, or so I mean, in some countries, European countries, problems detected in some of them to implement an adverse events reporting system by healthcare professionals, including in that medication errors, can have this kind of explications, cultural biases or corporative culture. Maybe as a conclusion, these professionals are afraid of the legal consequences of reporting for themselves or their closest colleagues. But nowadays, we have to keep in mind that reporting is compulsory in some situations, especially related with the pharmacovigilance system. And so the minds should change or not, but they have to go according to the law. To meet an efficient reporting system, some reporting preconditions are needed. For instance, to create an environment of trust, implementing a confident environment between professional and patient, and promote a transparency-based system to give facilities for open information, emphasize the advantages of a reporting system neutral legally, that is very important, and to keep an isolated, also very important from a legal point of view, an isolated reporting program from other legal needs, requirements, or legal consequences, as preventing to extend the adverse events reporting system to other legal duties of communicating harm to concerned authorities like police, courts, and so on, as I said previously. To implement our reporting system, we have some legal tools at the European Union level. Well, the Amended Directive 2001/83 that has been mentioned by Mike Foy when he was speaking about this. And so, well, thus I would like to go further on this directive with the amendments of 2010. But I think that is, legally speaking, is relevant to keep in mind, to remember that there are all other legal international instruments that could be useful for our purposes. I am speaking about the Council of Europe recommendation of 2006 of the Committee of Ministers to Member States on management of patient safety and prevention of adverse events in health culture. It is not the topic, it is not just medication errors, but in a general view, more general view. Well, let's go to the directive. Well, as you know, for our lawyers, recitals, explanatory report sometimes are more important than the regulatory part of a law or a legal instrument. So this is the case, I think, with this directive of 2001 as amended in 2010. For instance, recital 5 states that, or explains, strictly speaking, the definition of the term adverse reaction should be amended to ensure that it covers noxious and unintended effects resulting from medication errors. Well, this recital states also that a reasonable possibility of there being a causal relationship between a medicinal product and an adverse event should be sufficient reason for reporting. This causal relationship is also very important, very relevant in legal terms. The term suspected adverse reaction, as it is explained by this recital, should be used when referring to reporting obligations. Member states should ensure that reporting and processing of personal data related to suspected adverse reactions, including those associated with medications errors, is carried out on a confidential basis. This is also very important, as I think that this is a pillar of the reporting system. No, it doesn't matter whether it is about medication errors or in a more general view or focus that as is in relation with in general adverse events. And finally, the principle of confidentiality should not affect the obligations of the persons concerned to provide information under criminal law. Well, this is a matter for discussion, I think, because I am thinking not only in the professionals that have reports to the reporting office, but also in the members or the staff of this reporting office that also usually this staff is managing anonymized or anonymized data information. At the end, they are able to identify the persons involved in an adverse event, in a medication error. And so the problem is more delicate when it is possible that a criminal law has something to do with this adverse event or with this medication error. While the recital 17 is also very important to understand the extent of the directive in relation with these adverse reactions, specifically addressed to medication errors, and so that you can see that including information on suspected adverse reaction arising from use of medicinal product within the terms of the marketing authorization, as well as from use outside the terms of the marketing authorization, and so on. Well, Mick Foy was speaking at this adverse reaction, and I think that Thomas will also explain some things about some thoughts about this definition. Adverse reaction, a response to medicinal product which is noxious and unintended, so it has been shortened in the modification in 2010. Well, you know that that lawyers we appreciate much legal definitions. Also, when I was listening, Professor Aronson with all kind of the definitions concerning error, I was delighted to listen him. And so Mrs. Shrine, when also she was concerned with some definitions. Well, legally speaking, definitions are very important because they explain the extent in which the discussion can be made. So more than in a line of thought of a discussion. Legal definitions are binding also for courts, for legal authorities. Well, we have also the Article 101.21 that the pharmacovigilance system shall be used to collect information on the risks of medicinal products as regards patients or public health. Well, the patients, public health. That information shall in particular refer to adverse reactions in human beings arising from the use of medicinal products between the terms of the marketing authorization as well as from use outside the terms of the marketing authorization and so on. Well, as you can compare with the recital 17 and so to see that is the same idea, but here regulated. That is very important. And finally, point 2, I thought that it was also interesting to underline it. Member states shall evaluate all information, scientifically consider options for risk minimization and prevention, and take regulatory action concerning the marketing authorization as necessary. Regulatory action. So this action by member states is also necessary, but in coordination with this directive and with the main principles that have been stated by the European Union. I mean, also the European Medicines Agency in the terms that it is possible. Well, this is also very important, risk minimization and prevention, and take regulatory action. Well, don't forget to learn of also this. Well, I was speaking about the Council recommendation, so I think that it's not necessary to go further, but I call your attention from the paragraphs A, B, C, especially. But it's just to show that there is consistency with the dominant ideas in relation with the adverse events reporting system that is dominant in Europe and other countries. And so I think that it could be also, as I said previously, a way to reach, to get coordination among member states. 47 member states of Council of Europe, from which 27 are members of the, as you know, the European Union. Well, the need for a legal support for a reporting and register of adverse events, I only wanted to underline this couple of ideas that as a great importance in order to ease and to give the necessary support to the establishment of a system of reporting and register of incidents and adverse events. Well, we can also speak about specifically, according to the Directive 2001, as amended, provides a supporting core for the essential legal framework on reporting medicament errors, and so in this case we are speaking about adverse reactions, as it is stated in Article 1. Main purpose is to establish the legal issues which can be relevant in order to determine the position of the different legal professionals, judges, lawyers, in relation with such a reporting and register system, especially when the latter includes the communication of adverse events with harmful consequences of any person. Well, the purpose of reporting by healthcare professionals or practitioners, well, you can see there. I would like to also to underline the last sentence. A goal of our reporting system should be isolated from any other labor, court, or legal issues. This is very important, to be isolated. This is I think that one of the pillars, the basis that can guarantee the success of this kind of systems. Well, this is so for me it's also relevant to be stated what is the status of the members of the committees responsible for the root cause analysis. So that as I said previously, the professionals that receive the reports. And so, because due to the analysis performed of the adverse event by these committees, its members could achieve an in-depth knowledge of the adverse event, being capable of identifying the persons involved in the adverse event resulting in harm. And so that could have legal consequences also for them. Well, this is a summary of conclusions and recommendations. Well, I state summary, but this is very long, so I think that I have to jump to some of these slides to other because I have no more time, just so a couple of minutes. Well, I would like to go to the yes, the importance of these reporting systems. Well, it is not as to speak directly of about legal consequences of the, but I think that these systems have legal consequences, very important, because they can decrease the cases of for criminal prosecution in relation with negligence and so on. So it is in my experience in the case in Spain, the analysis of the rulings of the court sentences passed by the courts of different jurisdictions, not only criminal but also in relation with torts and so on, shows that a substantial part of these condemnations of these torts could have been avoided if having in place a reporting system. This is very important because it is also a basis to reach this confident relation between the patient and its family, her family, and the professionals, healthcare professionals. Very, very important to diminish the legal issues that can go to a conflict, legal conflict at the courts. So the reporting system is a very good tool for this. Well, also you can see this some conclusions or and the 6 is also very important, as I was saying, that the possible link between an adverse event or medication error and a case of legal responsibility, which is known by the health professionals, constitutes a problem in some countries, at least in some legal systems, member states' legal systems, a problem in order to create an adverse events report system and so on. Concerning this reporting system should be established on a confidentiality basis. This is, I think, there is a common opinion of the reporter's identity. Furthermore, both the creation and the come into operation of a register with the reports resulting from the adverse events system could be subject to the legal regulation on personal data protection. At the 11th, a reporter should be entitled to avoid to report to the authority, the police, of the judge, and to declare if the declaration is imposed by a judge according to the law. So something should be changed, if necessary, according, I shall repeat it, this idea accordingly to the legal system in some countries, in some member states. And the same idea is that some solution can be cut for the members of the teams in charge of the root cause analysis and of the revision of the reported adverse events. Well, I think I have to finish. Thank you for your attention. Nothing more.